Hello and welcome to Open Line. I'm Starlene Stringer. In early March of 2020, the word was beginning to spread about the novel coronavirus, and by the end of the month, the state of Texas, like many others, was under a shelter-in-place order. Now, in the months that have passed since then, COVID has claimed a constant place in our collective attention. So on this edition of Open Line, we'll take a stock of where we've been, where we are now, and what might be ahead. We're going to hear from the Office of Emergency Management and from Dr. Joseph Chang, Chief Medical Officer for Parkland Hospital, that's Parkland Health and Hospital System. But first, let's take a look at the ways the City of Irving helped residents and businesses overcome some of the financial hardships brought about by the pandemic. Joining me are Delisa Geerling, Community Development Manager, and Imelda Speck, Economic Development Project Administrator. Thank you both so much for being here.
Thank you for inviting us.
You're welcome. Now, I know y'all were both involved in coordinating programs to help in several areas of need in the community. And Delisa, I have to ask, did your role change in response to the circumstances around the pandemic?
It changed slightly, so that's kind of like a yes or no answer. Yes, in the means that we had to change the way we did business in the office, whether we had to learn and shift to Zoom or meeting clients over the phone or working through the house. But as far as assisting clients, no, that did not change. We continue to help our clients through this whole part of working from home and different pandemic situation we're in right now.
Wonderful. I'm sure that it's much appreciated. Imelda, I've got to ask you, can you tell us what your role has been during the past year?
Sure. So in economic development, obviously working with small businesses. So that was expanded with what we did with COVID. But my role expanded in overseeing particular funds we received and creating programs for housing, childcare providers, another small segment of small business, and then childcare assistants. So it was mainly overseeing our third-party administrators to help provide those programs and making sure that the funds that we had got distributed to our residents and businesses.
I see. All right. Well, COVID-19 really had a definite financial impact on businesses and families, as you said. And I want you both to talk a bit about how critical that need was. And let's start with you, Imelda.
Sure. So we first, to even try and assess what COVID was going to do to our businesses and residents, we really dug deep into the data to see what was the status of businesses and families prior to COVID. So trying to look at that and understand our community and then what the potential need might be. So for example, with just in the first month from March to April, as you mentioned, we saw we saw a triple in the unemployment rate. So going from 4.1 to 13.3%. Wow. We saw industries of the leisure, education, other services like our salons, personal care, gyms, being the hardest hit industries within that first month and obviously throughout. And those industries represent some of the lowest median incomes that we have in Irving. So looking at that, looking at housing burden on our residents now, we were able to estimate a potential impact need of almost $7 million for residents with mortgages because they're no longer working because we had the shelter in place order, and then almost $32 million for rental assistance, and then $11 million for utilities. So seeing that critical need, that's what helped base the information we use to help base our programs on. So nice. For what to create basically. So
that makes
a major impact there as to for our local economy from businesses to residents there.
Wow, that's a lot to take in. I'm glad you were there to process that and go through that to see how you could help. And Delisa, was that your experience as well?
Yes, we in our community development division, we normally run an in-house rental program as well as a rapid rehousing program. And when COVID hit and we had the stay-at-home orders, we all of a sudden saw families that, overnight lost their jobs. And so they get into a crisis mode and going, do I pay my rent or do I feed my family? And so we were able to help burden some of that for some of our families through our rental programs. And then any family that became homeless, we were able to assist them to get back on their feet with additional assistance. But, we also provided funding to some area nonprofits in the area to help assist families in the community in different ways, and some like job training and different things that came out of the pandemic and staying at home, as well as we created a new program, which we had not been able to create before, was a mortgage program, and to assist families that are, lost their job and now they can't pay their mortgage, not just their rent, but their mortgage. And so we were able to create a new program through this funding to help with the financial burdens.
Wow. Okay, let's talk a little bit more about that. I want to talk about the specifics about the funding made available through various governmental programs. And I have to ask, what programs did you administer, Imelda?
So I oversaw the funding we received directly from Dallas County through the CARES Act, and that funding helped to fund programs for the small business assistance. So looking at businesses with less than 100 employees making a revenue of less than $1 million. So it was a very targeted segment of small businesses in Irving. Mm-hmm. We assisted with housing by providing mortgage and rental and utility assistance. And then we had a child care provider grant to help our child care providers get some upstart funding. This was in addition to the small business that they could use as well for PPE, and then any other minor needs they needed, because as we were reopening, people needed to be able to send their kids to childcare because schools are still closed. And then we also provided childcare payment assistance because families hadn't been working and they would not be able to pay for the childcare without that. So we were able to put those 4 programs to kind of create this network, if you will, of assistance that was well-rounded for our community.
Wonderful. And Delisa, tell us about the programs you managed.
I oversaw the funding that we received through the CARES Act that came through HUD, which is the U.S. Department of Housing and Urban Development. It's kind of it was all under that same umbrella, and we received that funding. And so what we did with that is we enhanced our normal rental assistance and rapid rehousing program. And then we did create new programs, like I've mentioned just a minute ago, about the mortgage assistance. And then we also were able to, again, enhance some programs in the community with that particular funding that we received from HUD, and had to have that COVID tie to help prevent, to prepare for, or respond to COVID.
Yeah, so these partnerships really helped you do some great things in the community. I have to ask, what's your assessment of where you are now, Imelda?
I would say looking ahead, we're more in a recovery mode. All the programs that we've been talking about, as Lisa said, were crisis mode response, right? So what was the emergency need? Going forward, looking at programs I may oversee, it's how do we help these businesses recover and become resilient? So they've made it through all the shutdown orders, and it's now about reopening to a community that is still concerned about COVID that's out there, and trying to set them up should another health pandemic or emergency like a weather storm, for example, happen, how to help them become resilient and be able to take those disasters on. So providing the tools and resources for that versus just one-time payments for rent is what we're looking at to, again, build up their foundation of their business.
Wonderful. For that information, we're grateful, and we're glad that you were able to help out in that way. We're just about out of time, but I want to go back to you real quick, Delisa, and ask about the city departments you work with and those partnerships too. Can you tell us about those?
Yes, in this the latest funds that we received from HUD, we did set aside some funding to assist with the library and parks and recreation departments to enhance their programs that they provide to the residents, to prevent, to prepare for, and to respond to COVID. Currently, we are working with the library. We're just about to kick off a program with them to help with mitigate some of the hotspots and tablet needs that maybe the community needs that they are not able to afford. And so we're working with them, hopefully, to kick this program off during the summer.
Thank you both so much for being here and sharing this valuable information with our viewers. If you or someone you know is in need of housing or financial assistance, please visit cityofirving.org/COVID-19 for information and helpful resources. The Office of Emergency Management played a critical role in the city's ability to address the unique challenges the pandemic presented. Jason Carrier, Robert Medford, and Dia Scully join me now to talk about how the city mobilized to address these challenges. Dia, let's start with a brief overview of the mission of the Office of Emergency Management.
So the Office of Emergency Management is responsible for coordinating the city services during a disaster. Part of that responsibility is creating plans and practicing those plans with the city. And we also, in that process, we train with all departments across the city, top all the way down. And we deal primarily with the city, but we also work with the public and the private businesses and training within their own companies so that they also have disaster plans on hand.
A lot of work and a lot of people you've been working with over the past few months, if not a year or so, for sure. Jason, I want to come to you next because I understand you've got a very comprehensive mission, and I'm sure your team put all your training to good use when it became apparent just how the pandemic was really going to affect so many aspects of our lives. So can you talk about those early days and what you had to do as a department to mobilize?
Absolutely. So in the winter of 2020, we started watching as the situation unfolded overseas in Asia and saw kind of what was happening globally. And then everything just kind of steamrolled from there. So on March 11th of 2020, the World Health Organization classified the coronavirus as a pandemic. And then very shortly after, on March 12th, Dallas County issued an emergency declaration. And then the same day, Mayor Stouffer issued a disaster declaration for the city of Irving. And then shortly thereafter, on March 17th, we had our first Irving residents case, which caused us to, not really be alarmed, but figure that we need to posture forward and figure out how this is going to impact us. So on March 27th of last year, we partially activated our Emergency Operations Center to help manage what was unfolding before us. So coordination of the city as a whole began to include getting the right individuals in the right place and figure out what we needed to safely and efficiently respond. Many high-level coordination meetings were held to determine exactly how this would impact the city of Irving. So we began to coordinate with our whole responder community to support a rapid and effective response. We collected and disseminated accurate incident information to improve decision-making because things were changing almost on a daily basis. We also were tracking incident costs with our assigned resources we had out in the field for cost recovery. We also were in the business of acquiring supplies and equipment to support City of Irving departments so they could do their normal job. So at the time, getting hand sanitizer, personal protective equipment, and other items, everything was very hard to come by. So we tried our best to ensure that all departments had the supplies that they needed, as well as we tried to protect our vulnerable populations by promoting mitigation strategies with our partners and the public, ensuring visibility of the disease's progression along with timely and actionable information to our stakeholders and the public. We set communication messaging for the event based on the science and circumstances. So we wanted to ensure from the get-go that information was being pulled out, pushed out in the public, and there wasn't any misinformation or trying to squash that as it was arising, like I said, on a daily basis. Setting up a call center. So early on in the Emergency Operations Center, we set up a call center with a dedicated hotline with staff to answer questions from the public, as well as a dedicated email address where individuals could email in questions or concerns, and we would respond back to them in a timely manner. And like I said, everything was very fluid initially since things were changing daily. So we just had to constantly try to stay one step ahead of what was happening as the things were unfolding before us.
Wow, there was so much going on behind the scenes. Preparedness is really a hallmark of the Office of Emergency Management, and your training and drills are well known in the community. Rob, can you talk about how those efforts prepared your team to face challenges as yet unknown?
Well, sure. None of us had ever worked in a public health emergency of this magnitude. So we were kind of writing and rewriting the book as we went. Fortunately, there are a lot of elements of emergency management that are interchangeable, and we train on those elements constantly. So as the situation would change, as the needs of the public changed, and they constantly changed the first few days. It was almost like drinking from a fire hydrant for about the first 3 weeks. We looked for key elements of emergency management that we knew well, and we would try to fit those elements to the situation that we were in at the time. It really worked out well. That's the great thing about those key elements, is they're interchangeable.
For sure. There was so much going on. I want to switch to you for a minute, Dia, and ask, what did those early days really feel like for your staff?
I think that it was really quite surreal. It's in school, we always talked about what is the worst case scenario, and it was always a pandemic. And so, we had like Jason said, we had started hearing whispers of a virus. And then, come January, the United States had their first case. And I think at that point is when we thought, okay, this really might be coming our way. And I remember thinking, okay, this could be our worst case scenario. And that's where we ended up. And so I think that, it was at that point that we all just took a big breath and began to put our plans into place and to do the best that we could to protect our city and its citizens in whatever way necessary or possible.
Yeah, y'all did a great job, all of you, working throughout this. I want to go back to you, Jason, because I know your department really developed some partnerships and worked with partners already in place to meet some of the needs throughout the community. So one of those partnerships was the communications department. And I want to talk about how they were able to address getting the word out to people throughout the city.
Right. Well, that was one of our top priorities. It was the top town was to ensure accurate, timely information. So we in the EOC, we usually is public safety centered events or public works centered events. We normally have communications in the mix, but they don't play as big of a role. So when we activated the EOC, our Emergency Operations Center, we had 2 of our city communications staff in there at all times. So we tried to hit the gamut of communications. In today's day and age, social media is so big. So pushing information out on social media, the city website, we did mailers, doing ICT and videos so the public could view with information, and just working with the public to ensure that they're getting the information through the HOAs, the neighborhood associations. So they used their normal tools, but kind of adapted it to push the information out in regards to the coronavirus. So it was very beneficial and very critical for us to be able to do that in a timely manner.
Job well done. Dia, what were your takeaways from witnessing the cooperative relationships that you all fostered during this past year?
It was great. My takeaway from witnessing those relationships is just I came away from that with a sense of pride for the city and its employees. I think everybody just stepped up to the plate when they were asked, and there weren't any complaints. And it was a great opportunity to get to know people in departments throughout the city, especially while we were doing the vaccination site. That 13 weeks, every week we had different people from different parts of the city coming in to volunteer to help us run that site. And personally, I was very pleased with how it's gone and just loved the time that I've been able to spend with other employees.
That's wonderful. It sounds like there were some really important wins that happened in this process. And Rob, what would you say was an important win overall?
Well, I think it's the way the city came together, all the city employees. I have to agree with Dia and Jason. Just people that we wouldn't normally have in the EOC came in, they fell into place, they worked together real well. It was just great to see how they interacted. It was great to develop those new relationships with those different departments.
Definitely. And Dia, would you like to add anything to that?
I just think it was a big win that the citizens of Irving got to see. They had the opportunity to see how much the local government really does care for them and cares about their welfare. The city worked hard to help those that were in need, whether it was through the food having the North Texas Food Bank events, or even doing the vaccination site. That was a big that was a big deal for us because we didn't have anybody doing vaccinations on the west side of Irving. So, we saw that need and we worked really hard to meet it. And I think it's important for the citizens to be able to see that as well.
For sure. Hey, as we wrap up, I'd really like to get your take on where we are now. Jason, let's start with you.
Well, we're still dealing with this, and the coronavirus is going to be with us for some time to come. We're on the long road to recovery as a community and as a nation. So, we're still seeing all the numbers are trending down. Our hospital capacities, the percent of people testing positive for the coronavirus are trending down, but we should still stay vigilant and continue to monitor that. In Irving, we're sitting at 24,933 confirmed cases, and 244 Irving residents have lost their life as a direct result of the virus. So we want to continue to remind the public, we need to be vigilant again and, practice social distancing, continue to support our vaccination efforts. Dallas County, a good win is currently setting about 51% of the population in our Dallas County community has been vaccinated. We're trying to ensure that the federal dollars that are being pushed down our way are being directed towards the right programs and entities to ensure the needs of the community are being addressed. We're closely, like I said, monitoring the hospital and public health data on trends in our region. And as they continue to trend downward, we need to keep an eye on that to ensure if they do start spiking back up, that we're prepared to respond to what it brings to us. And we're currently reviewing our response to the coronavirus pandemic to learn from this incident to be better prepared for the next thing to come.
Thank you so much. Y'all, we are out of time, but it's been so great to learn about all the ways you worked in the community to help get through a very challenging year. Thank you so much for being here, and congratulations on your success.
Thanks so much.
Dr. Joseph Chang with Parkland Health and Hospital System joins us next. But first, here's another look at the Vaccination Site, a joint project between the City of Irving and the City of Grand Prairie. Dr. Joseph Chang, Chief Medical Officer for Parkland Health and Hospital System, joins me now with an update that, you can use to help plan summer activities as we slowly create our new normal. Thank you for being with us today.
Yeah, I appreciate it. Glad to be here.
It's a pleasure to have you. Look, let's start with where we are now as compared to a year ago in terms of COVID-19.
Now, what a difference a year makes, right? Looking back a year ago, in March, April, and now May, we had just gotten through our first wave of COVID, and we called it a wave. Then little did we know that was going to be barely a ripple compared to the next two peaks that we had. But we are sitting here today at the lowest level of COVID in our community since really the beginning, and we're really excited about that and hope that continues. And of course, the way to continue that is to continue our push for vaccination.
Definitely. And I know vaccinations are changing. A lot of kids are now able to get that if they're over the age of 12, right?
Yeah, absolutely. We're super excited about that. And it's not surprising. We knew from the very beginning that this vaccine was going to be safe, and really it made no sense that it would be any safer for adults than kids. So we knew that once the data was out there, it would show that it was going to be safe for children. And we actually are fully confident that as more studies are done, it'll be shown safe for even the younger children. And that's even more important because right now, the fastest growing demographic of COVID in our community is the 0 to 17 age group.
Wow.
That is actually the only age group that has grown in proportion since the beginning. It has never dropped. So that really shows us that this is really becoming our most vulnerable part of the population, and also the part of the population where the disease continues to spread.
Wow. Okay. So the vaccination's a good thing for sure then. And we want to talk about something that kids are celebrating even more than a vaccine. For kids, it's summer and the end of school. And as the school term ends, many families may want to take advantage of travel opportunities. I mean, what do they need to know to stay safe?
Yeah, absolutely. Listen, I've traveled as well. I think that's one of the things that we all miss, right, about our lives over this last year. It's been really restrictive. I myself haven't seen my family. My parents, I've of course seen my little family, but I haven't seen my parents in almost a year and a half. And it's been really tough. Listen, travel is fine, okay? But the things to consider are these. Number one, are you and your family vaccinated? That is the number one and best way to protect yourselves and those around you. Number two, what is the COVID situation and wherever it is that you are going, right? That's going to be something for you to think about. The other thing too is how are you going to get there? Obviously, sitting in a metal tube at 30,000 feet for several hours is going to be a lot less safe than driving your own car with your own family in it. So those are the things to consider. Of course, if you're going across the country, you can't drive it. You're going to have to fly it. If you do fly, again, the best thing to do is fly 2 weeks after everyone has been vaccinated. If that's not possible, get your mask on, keep it on the entire time, and stay as distanced as you can. Now, we obviously understand on airplanes that's not necessarily possible, but certainly keep your mask on.
In addition to wearing a mask and trying to stay at least 6 feet apart, what else can you recommend as far as social gatherings and activities? What precautions do people really need to observe?
Yeah, we've talked about this a lot. Outside is better than inside, right? That seems to be common sense, but it's something that we keep harping on because we still see people gathering inside with hundreds and hundreds of other people, which obviously is going to be less safe. Now, as we get everybody vaccinated, we can get back to that new normal, as you talked about, and start gathering indoors and feel good about it. But right now, in our communities, we know that the vaccination rates are not quite at that level that we call herd immunity yet. And so if you are going to go inside, try to keep the gathering small and certainly keep your masks on. Outdoors now, the CDC has said very clearly that we can start taking our masks off as long as we're vaccinated. So we're definitely moving toward almost a new normal, but vaccination, as you can tell, is going to be key to that.
In addition to vaccination, would you like to add any final words? I mean, you're the expert. What kind of advice would you like to add for our viewers as we close?
Yeah, and I think the message that I would give to everybody is this: stay smart, stay safe, and you're going to get through this, okay? But I still have to say one more time, the number one thing you can do for you, your family, and those around you is get vaccinated. This vaccine is safe, it is effective, it has been shown over and over and over again. So you can feel really good about going out there and protecting yourself.
Thank you so much, Dr. Chang. We're so happy you could join us today for the show. Much appreciated.
Absolutely, thanks.
And thank you for watching. I'm Starlene Stringer. Please be sure to tune in Thursday, June 3rd, for the next edition of Open Line. We'll see you then.